Great. Hi, good morning. Welcome, everybody. My name is Tracy Di Maria. My pronouns are she, her, and I am the Executive Director of the Mid-America LGBT Chamber of Commerce. I'm so pleased you've all chosen to join us this morning. Thank you. We are recording this session. We're just thrilled that Dr. Chang and others from her team can join us, but we're also aware that some people couldn't get to the session this morning. So we wanted to record it and offer the information to others. I'm going to pass it over to Dr. Chang in a moment. We are happy for you to take questions. If you want to write questions in the chat, I will be monitoring that as we go along. I'm sure we'll have plenty of time at the end. If it's a question pertinent to what Dr. Chang has just referred to on a slide, I will try and interrupt her, and we will either read your question out, or you can perhaps take yourself off mute and ask your question. But it's quite an informal session. We want you to be able to ask questions and learn all about this important piece of work. I would ask that everybody puts themselves on mute before then, just so we can give the floor and have clarity of sound to Dr. Chang. And I will also be putting in the chat box a web link directly to the full review and survey. It is worth looking at, it's worth reading. I've had a look through it. It is comprehensive and incredibly informative. So I'll be putting that in the chat box as well. So with that, Dr. Chang, I'll hand over to you.
Thank you very much. This is such an honor. We worked on this project for 15 months, so to be able to share the findings is really a joy and pleasure for us. I am going to pull up a PowerPoint, and it's been a second since I've done Zoom, so thank you for your patience. All right.
Oh, yeah. Yeah.
Can everybody see this?
Yes, that's great.
All right. And do I need to change views on this? Or can you see this okay?
No, that's a great view. I'm seeing it great. So yeah.
Okay, awesome. So I'm Karen Chang. I'm the Associate Director of the Urban Education Research Center. And I see that Leah Youngren, who's also from the UERC, is here with me. And we're just really delighted to share the findings from the KC Voices of Pride project. That was our name that we came up for the community needs assessment. I'll go through the details of how we collected the data and our key findings, but I just want to let you know that we do have a website, and we encourage you to go to that after this presentation. Today is really just going to be high-level findings. There's much more detail in the report. So just a little bit about the Urban Education Research Center. And if you don't know, we are housed at UMKC within the School of Education, Social Work, and Psychological Sciences. Our mission, as we share with folks, is to create reliable, usable knowledge with the goal of promoting excellence in education and improving the lives and community opportunities for folks in Kansas City. Most of our work is done in Kansas City. I've lived in Kansas City for 30 years. So this is the heart of what we do, and we want to make sure that we're giving information and data that's useful to our city. So I start with this slide. This is actually when we wrote the proposal. This is what we started with, because I think it's important to kind of level set here. According to the Williams Institute, an estimated 60,000 lesbian, gay, bisexual, transgender, and queer individuals live in the Kansas City metro area. This data is based off of some national data that's collected at the state level called the Behavioral Risk Factor Surveillance System. So we know approximately 5%, according to the population estimates, of individuals in Kansas identify as LGBTQ plus, and about 6% in Missouri. I always like to say you can't walk through Kansas City without seeing folks who look like me, like many of us on the call. We are lawyers, we are teachers, we are police workers, we are construction workers, we are your neighbors, we are your houseless. We are everywhere in our community. It's important to know what our needs and what our strengths are. And so I start this with that, knowing that this is really important to know what the needs of our community are. And so many of you may wonder why the needs assessment now? Why did we do it in 2024? I would say a couple things. One is that when you actually look at the literature and you look at needs assessments, you see a lot of needs assessments happening on the East Coast, a lot on the West Coast, and then you just have kind of a handful in the Midwest. There's one that was done in Chicago, but we really have kind of an absence of data around just basic information about who we are, how we identify, where we live, what are our needs, what are our strengths. And so, just from a kind of national perspective, we have kind of a hole in the literature around what's going on in the Midwest. I would say specifically to Kansas City, there's been a handful of needs assessments done with very specific populations, but there hasn't been one that's very kind of global and very general in terms of its orientation. And so that was a hole that we really wanted to fill, and we were fortunate to have that opportunity. So really, I would say there were three goals for this needs assessment. One was just to describe who are we, where do we live? Like I said, how do we identify? What do we love doing in our city? What are we struggling with? What are our challenges? So just that description. The second was to give voice to the thousands, the 60,000 Kansas City LGBTQ individuals. It was 2024. I know it's hard to go back. A lot has changed, but people had a lot of things they wanted to share, and we wanted to give voice, a forum for folks to share out what they were feeling at that time. And then finally, just to spark conversation and drive advocacy, we know that there are some misinformation about what's going on. And so we wanted to really give data to drive that conversation, to drive the advocacy. And so our focus was really on basic human rights for all individuals, but particularly for LGBTQ individuals. And that included safety, economic and housing security, medical and mental health, legal assistance, community connection, belonging. We know that's so important. And then civic engagement. In full transparency, I want to share just the funding and oversight for this project. Really, this started back in 2023. I think I see Angie Cottrell on the call. Conversation that we had with the Pride Charitable Fund, who wanted to do a needs assessment. The Pride Charitable Fund is a grant-making organization, a nonprofit, that wanted to be data informed about how they were distributing funds, but also supporting the community. And so this was something that was really on their radar. They wanted to contribute to the city. And so with their support and their just their oversight, we applied for a grant with Rebuild Kansas City. We're funded in 2024. And so that was the primary funding for this project. We had a team at UMKC. I'm really happy to share a multidisciplinary team, Dr. Angie Cottrell, myself, Dr. Laurel Watson, who's in counseling psychology and works with mental health and trauma, Dr. Todd Wells, who is over in student affairs, Leah Youngren and Brielle White, who are on my team. So really a diverse group of researchers at UMKC. And then we had an advisory committee that consisted of several folks, many who are actively engaged in policy, in delivering frontline LGBTQ services, who are really advocating on the day-to-day basis. We knew that was critical in advising our work. I want to call out a couple other consultants who help with us. Celia Ruiz, who helped us with our focus groups, Nyla Foster, excuse me, who also helped out with our focus groups. We knew that we needed folks who were going to be able to facilitate for us, and they were just incredible. And then just a couple other resources. These were so important and so helpful to us. The Horizons Foundation out of San Francisco, who have done really incredible work. They did a needs assessment in 2018. They continue to do other needs assessments. We talked to them at all stages during our process. They shared resources, documents, insights, lessons learned. And then the Morton Group out of Chicago were also helpful in helping us frame this. We could not have done it without them. There was a lot of hard points in the process, so just wanted to call out their support. All right, so what did we actually do? Well, we really modeled it after the San Francisco needs assessment using a mixed methods approach. And I know many of you were engaged in either or both of these, so I will describe it, but hopefully you're familiar with it. We did a community survey. This was a survey that included 50 items, both open-ended and closed-ended questions. We used a method called snowball sampling, which is basically identifying LGBTQ organizations in our community and asking them to share it widely. And so that was the approach, and then they shared it widely with their friends. And so we really used our network to share out that survey. We shared out, I will show you the list shortly, but about 30 different organizations and partner organizations that we initially identified. There were several others who then got sent the survey. So that happened, I believe we started in March and we closed that in September. So kept that open for several months. And then we went into focus groups. So these were focus groups with LGBTQ serving organization leaders and some policy folks. These were folks who we wanted to share the data with, get validation from, and then really pick their brains about some of the root causes and some of the solutions that they saw moving forward. And so we did 6 focus groups with 15 organization leaders. We ended this whole process in March of 2025. Our initial scope was going to be for a year, but we really wanted to take the time to make sure we made sense of all the data. I know this slide is probably too small. We will share out results, but this is just a sample of the organizations that we reached out to and that we shared the survey for them to disseminate. So as you can see, many organizations across the metro. One note is that we use the 14 county Kansas City metro statistical area, and so really tried to recruit rural, suburban, and urban, as well as a diverse portfolio, both by age and race and ethnicity. And then as you can see, in terms of events, we were all over the city in the summer sharing the survey. We did provide some incentives, particularly at the end of the survey process, for those who participated. All right, so I'm sure you're anxious to get to the data. So let me just share out first what our survey response set looked like, what our final sample looked like. And I'm really happy to report that we had a total of 1,156 individuals complete the survey. I know this seems like a modest amount, but honestly, when you compare to San Francisco, who had about 1,800 individuals complete their survey, Chicago had about 1,600. For our city to get over 1,100 individuals to complete the survey was an incredible accomplishment. I'm really proud of our team for accomplishing that goal. Making sure that we were representative and that we got a variety of voices was critical. So you can see here, this slide shows just the breakdown by sexual orientation and gender identity. We did follow San Francisco's guidance on how to ask these SOGI questions. And so you can see here, folks were given the opportunity to respond to particular categories, but they were also given opportunities to write in their responses. So you can see that particularly on the gender identity, that we have a variety of different response options. County of residence, you can see that about 55% of just over half of our respondents came from Jackson County, which makes sense. We did a lot of our outreach in Jackson County, and that was followed by Johnson County, then Clay and Wyandotte. We tried really hard to get into our rural areas, excuse me. But we just really struggled. We provided incentives, cash incentives, et cetera. What we heard from folks is that there just aren't great organizational structures out in the rural areas for us to do distribution. And so this was a real challenge for us. I think we can talk later about strategies to overcome this, but this was, again, one of those areas we struggled with. In terms of household income, we had about 2/3 of our population, our sample, making over 50,000 and about 1/3 under 50,000. So we felt pretty good about having that income distribution in our sample. And then in terms of racial and ethnic identity, just under 80% of our sample was white. About 11% of our sample identified as Hispanic, Latino, or of Spanish origin, and just about 6% of our sample was Black. Again, this was an area we worked really hard in the final months to try to boost our Black population. We know that in the Kansas City metro area, that's about 11% of our population. Again, providing incentives and outreach. We just didn't hit the mark on that. Again, we can talk about strategies for that, but we recognize that that's a limitation in our sample. A couple notes on that final sample, some of which I've already mentioned, but this study did take place during an election year. We want to be fully transparent about that phenomena, that the responses reflect the needs and strengths of our community between March and November 2024. I will note people were anxious, people were thinking ahead at that time about what was coming down the pike, but I do want to be, as I said, fully transparent that this was data collected before the actual election. I noted this, the final sample included fewer rural and Black individuals from the metro area. We did try to provide incentives. One of the things we did is that for any subgroup that was over 20 individuals, we did provide breakdown by subgroup so that you can see those data. And much of that is on the website. Today I'm going to kind of do high level, but you can go in and see the subgroup analysis. And then finally, the survey, as I mentioned, had both forced choice and open-ended responses or questions. I was amazed at how many folks on the survey, remember, this is a 50-item survey, took the time to write in responses, really detailed responses to many of the questions. And so we were so happy to have that level of detail, that we used that data in many ways to inform what we identified as the priority areas. So we used both the qualitative and quantitative data from the surveys and the focus group data to really generate these key findings that I'm going to share with you. All right, so are we ready to see the data? Okay, so as I mentioned, all the item level responses are in the full report, but I'm going to talk about the 5 key findings that came out of our analysis. And these are really findings around the biggest areas of need for our community, for our LGBTQ community. These 5 areas include, number 1, the need for political advocacy and local engagement. I'm going to share some data shortly about this, but that call for advocacy was very strong, both from our focus groups and from our survey data. Number two, the need to address violence toward our LGBTQ community. Very clear, particularly for the trans community. But I would say we see that across all different subgroups. Third, the need for safe and accepting public spaces. Many folks talked about third spaces, talked about being out in public, being comfortable being out in public. This again was something that resonated with folks, both in the survey and in the focus group. Fourth, and I would say probably one of the more important priorities is around access to healthcare. You can see both in terms of physical health, mental health, we have really significant needs. Some folks are getting them, some folks are not, but some significant needs around healthcare. And then finally, this need for improved LGBTQ plus community connection. We have great organizations in our community, but folks sometimes don't understand how these organizations are working together, or if they're new to the community, how to connect with community. And so we'll talk a little bit about that. All right, we start with political advocacy and local engagement. Some stats from our survey. About a third of folks who responded on the survey indicated that they do not believe that even one local elected official has their interests at heart. These are items, just a little background, these are items that we borrowed from San Francisco around political advocacy. Many of the items are really items that were vetted by the San Francisco folks and shared with us. So what I'm sharing here is just our respondents in Kansas City and how they responded to these items. So again, about a third of respondents didn't believe that even one local official had their best interests. Similarly, about a third of respondents don't feel that their local laws and policies support LGBTQ people. And then about 1 out of 10, just over 1 out of 10 of respondents don't believe there is even one LGBTQ organization or advocate in their county that would speak up for issues that affect them. So while that's lower than the other rates, that really calls attention to the need for organizations to really be more present, communicate more about their advocacy role. I mentioned that the issue around trans rights is critical. We saw a lot of folks chiming in, writing responses around transgender rights. So, as this quote says, as a citizen of Missouri, I worry about the ongoing battle with the state and transgender rights. This was voiced over and over again. I think we could probably ask this question now and see even more fear and trepidation around the laws and political advocacy in this arena. One of the other questions we asked was around, do you know where to go to provide input into local laws, policies, and decisions? And while just about half of folks agree that they would know where to go in terms of providing input, we have about a third of our LGBTQ community who don't know how to provide input. So I think this is an area of opportunity. Again, maybe more communication around how to get engaged. And then finally, on the political advocacy side, this last quote really speaks to that issue of representation. Someone wrote, sure, we've got allies, but it's still like there's nothing like having somebody who understands a true day-to-day lived experience in your community being in a position to be able to help impact and affect change. This really speaks to the need to advance candidates in our region who identify as LGBTQ plus and who understand what that lived experience looks like. I go now to the next finding, which is around violence in our LGBTQ community. On the survey, we asked individuals to think about different spaces in their community where they might feel safe and where they don't feel safe. And so we gave them several options: interacting with the police, in their neighborhood, where I work, at my home, uh, with someone I'm in a relationship, on public transit, and in public settings. You can see they provided the option of saying yes, no, or I'm not sure. Um, when we look at the data, we can see there's a couple places where people just don't feel safe. And one of those is interacting with police and other law enforcement. About half of our folks indicate that they don't feel safe interacting with police. The other two that kind of pop up are on public transit and in public settings such as restaurants, concerts, etc. About 1 out of 4 individuals indicate that they do not feel safe in those spaces. We also asked them and broke this down by gender identity about instances of violence. And we gave them 4 categories. We asked about physical violence, psychological violence, sexual violence, and verbal violence. These are not mutually exclusive, so they could indicate multiple forms of violence. A lot of data here, I know, but let me just give you the high level analysis. The green bar, verbal violence, you can see is the largest across all groups. So you can see verbal violence is the most pronounced form of violence across our different gender identities. Anywhere from 1/3 to 1/2 of our individuals are experiencing some type of verbal violence. The second most pronounced form of violence is psychological violence. And again, we're seeing anywhere from about 12% to 35% of our individuals experience some type of psychological violence. And then that is followed by physical and sexual violence, where we have somewhat similar rates across subgroups. I would note that, when you look, across all forms of violence, you can see that individuals who identify as genderqueer and non-binary are really experiencing quite a bit of violence across both verbal and psychological forms of violence. And so while everyone's experiencing probably disproportionate violence, we see some subgroups appear to experience more violence than others, at least self-identified violence.
Dr. Tang, can I just interrupt you with a quick question because it's pertinent to the last slide? Question,
yes.
How would you define the difference between verbal and psychological violence? Was that defined at all in the survey?
I think we left that up to individuals. I'll have to go back to the item, and I can let Leah chime in.
Yeah, we provided just a few brief examples in the text.
Okay.
So it would say verbal violence, like yelling, name calling, psychological violence, and now I'm blanking on the examples, but we did give a snippet of what we were referring to within each of these.
Thank you. Thank you both.
All right, so the next finding was around safe and accepting public spaces. So this is overlaps. Clearly, many of these areas overlap. This one is really about safe third spaces, so spaces to convene out in public and feeling safe to identify as LGBTQ. So again, going back to the data, we can see that about 1/3 or 33% of respondents do not feel comfortable being out openly in the city where they live. So we asked them to think about the city where they live and do they feel comfortable being out. About 1/3 as well, just under 1/3, 29% of respondents do not believe they would be helped if they were having trouble in a public space. So again, this is kind of getting to like, I feel okay being out in a public space and being myself. One of the things we did here, particularly in the write-in responses, is being out in public in groups of people that identify like me. So you can see from this quote, there are no spaces for really the Black queer community to be able to gather amongst themselves. So that's that sense of not only can I not be out as an individual, but I also can't be out as a group and feel comfortable. Now we move to the healthcare findings. And as I mentioned, we're both going to talk about physical health and mental health. I think the mental health piece, while they're both critically important, the mental health piece is really important. So, all right. So on the survey, we asked respondents to think about barriers to healthcare, and we provided a number of examples such as accessibility, financial barriers, insurance coverage, lack of insurance, wait times, and queer-oriented sexual health care. So these were examples we gave and asked them to identify if they had experienced a barrier to healthcare in the past 12 months. And as you can see, we broke it down by gender identity, transgender men. About almost 70% of transgender men have experienced a barrier to healthcare. That's followed by non-binary, transgender women, genderqueer people, and then cisgender women and men. So these are really pretty significant numbers when you think about access to healthcare. Provider knowledge, let's look at this quote. Provider knowledge came up over and over again. That is, having a provider who is responsive, understands the healthcare needs of individuals who identify as LGBTQ. As this quote says, provider knowledge, we can talk about access all day, but the reality is that most people, when they do have access, they are having traumatic experiences because people don't know how to serve them. So I think that notion of trauma associated with providers who don't know how to deliver sensitive care is a real thing that's happening in our community. And getting to that issue around sensitivity, we did ask on the survey about if they did have a medical provider, was that medical provider sensitive to either their gender identity or to their needs as a queer person? So two different items that we asked them to respond to. And they were able to respond on a Likert scale, a 5-point Likert scale. And while it's encouraging, I think that about half of folks agreed with that statement, both for gender identity and for queer identity. We still have, about 15 to 20% of folks who don't feel like they have a provider that is sensitive to their needs. That's not a non-significant number of people. And you can see most people say somewhat agree to this issue around having somebody who is sensitive to their needs. Now I want to talk a little bit about mental health and about use and access to mental health care. We asked on the survey if they had visited a mental health care provider in the past 12 months. You can see really high rates of use by transgender men, followed by non-binary, transgender women, genderqueer, then cisgender women and cisgender men. Our folks in our community are seeing mental health care providers at very high rates. We had several other indicators around issues around mental health. I just want to share one. 35% of our respondents indicated that they had been extremely depressed in the last year. So I think while this is kind of one of those things that is both good and bad, while folks are seeing mental health care providers, they are having persistently alarming rates of mental health crises or diagnoses. Finally, in terms of findings, I want to talk about the LGBTQ community connection. This was something that came up a lot in our focus groups, also in the survey data, just around feeling like they have a place to go and connect. Again, going back to the survey data, 32% of respondents feel like they don't have someone within the LGBTQ plus community to confide in. 15% report not having anyone within their community to get together with to have fun. 29% don't have anyone in the community to ask for help if they were sick. And 34% said they do not have a sense of connection to the LGBTQ community where they live. This quote, "It seems very disjointed, cliquish, and not supportive of one another." I think this was something that was shared by somebody who was involved in a LGBTQ organization. This notion that we have incredible organizations, but they're not always working seamlessly with each other. We broke this down by location and age. And you can see here location really ranges from Platte County, where about 26% of individuals feel disconnected to their LGBTQ community, to Clay County, where we have almost half of our individuals who feel disconnected. Age, again, variations. The largest number, the largest percentage is our older population, 50 plus. About 64% of individuals in that age group identifying as feeling disconnected to their LGBT community. But we also have a good set, almost 1 in 3 young individuals, 18 to 29, feeling disconnected. I think this data corresponds to what's going on with our younger population of just feeling disconnected in general. These are issues they want to feel connected, particularly people who are new to the community, articulate a desire to be connected, but not always knowing where to go. So now we get to propose solutions. I will introduce this saying I would call these introductory. So these were gathered from suggestions that were provided on the survey, as well as suggestions provided through our focus groups with folks who were identified as leaders in our community. So let's talk first about those proposed solutions related to political advocacy and to safety and to violence. Some of these will be no-brainers to you, so bear with me. But these are really coming from folks who spoke very eloquently around things they saw as actionable steps that could be taken in our community. One is clearly elect more LGBTQ individuals. We don't have many folks who look like us, who are representing us. It seems like that's a natural step, is try to advocate for individuals from our community. Second is enact non-discrimination policies in Missouri and Kansas. We can see we're actually probably moving backwards on some of those policies and laws. And so to really push back on that, to really advocate for non-discrimination, whether that's in housing or healthcare, et cetera, those are really important to make sure the folks feel safe and feel like their laws represent them. Passing legislation to protect trans people. No doubt this was said over and over again in our surveys, in our conversations with focus groups participants. This is a group that we really need to put front and center in our political work. As you can see in that section on violence, we can see that law enforcement is an area where we need to really lean into. So increasing sensitivity training for law enforcement. I know there's been some done, but there was really a call to do more, and that there was some inconsistency across the training. Likewise, increasing that consistency in the prosecution of hate crimes. We heard from several individuals that the prosecution of hate crimes is not consistent city to city, county to county. And so really making it clear that there needs to be a central approach to that that protects the rights of LGBTQ folks was again repeated over and over again. With regard to healthcare, with regard to community connections and sense of belonging in public spaces, increase the number of third spaces. So while we do have really great organizations that are opening their doors and spaces to folks, just that call for increased number of spaces. So many folks in the focus groups talked about cities where they had whole neighborhoods and streets that were known to be safe spaces. There was kind of this lament that our city didn't have that. There was also a lament from older folks that we used to have more spaces, particularly bars and restaurants that were safe spaces that have since shut down. So again, just increasing those numbers. Creating LGBTQ friendly spaces across public settings and locations, encouraging more advocacy organizations to collaborate. I think, again, on our survey and focus groups, people talked about this kind of zero-sum game in the Kansas City area where if one organization grows, then the other one feels like their livelihood is at risk. And so moving from that zero-sum orientation to an idea of let's collaborate and grow together. And then this suggestion of offering a diverse array of events and frequent and consistent event communication. I think we do that. I think it's largely around the communication of that. How do we have a central place where that communication is consistent and people, particularly people who are new to the city, know where to go? And then finally, around healthcare, we didn't talk a lot about access, but in our surveys, many folks talked about wait times, that they often had to wait 6 months or longer to get into a provider, that while they were good providers, whether at KU Med Center or at University Health, the wait times are very long. And so really increasing the number of healthcare advocates and providers in our area is key. Along with access to mental health care, we know that folks are going and they need mental health care services, and that is not going to disappear. So increasing and improving access to mental health care is critical as we kind of move through these next couple years. And then expanding, even just supporting gender affirming care is going to be critical. Those rights are under fire right now. And so whatever we can do to support that care is important to our community. I want to just shout out a couple of community strengths. We did ask a lot about needs, but we did ask, hey, if you look around Kansas City, what do you think are the strengths in our community? And I just want to shout out to a couple of those that folks identified. Clearly, and this was repeated over and over again, we have great organizations in our community, LGBTQ affirming community organizations who are increasing visibility and affirming attitudes about the importance of our community in the Kansas City region. Those are real strengths. We have Midwestern Nice, and our organizations are trying to raise that up. We have LGBTQ owned businesses that are sprouting out across the city. We just need more of those. They're incredible, and people recognize how much value they add. And then people talked a lot about our resilient community. We've been around for a while. We have weathered the tide of the good and the bad, and that we really are a resilient community. Um, as one member said, during the summer, there's pride flags everywhere, and the sort of representation, so visible. I think it makes people feel welcome here. Just a few pictures are of our adventures this summer and during our data collection. This was, I think, mostly at the Pride Fest. Again, I know many of the folks on this call were there and helped us, so a big thanks to everyone who helped us with data collection. Here's our team collecting data, again at the Pride Fest. A call to action, I think as the chamber, you are probably in a better position than us as researchers, but we had a few thoughts about calls to action, obviously sharing the findings. I put in the link to our webpage. Please share that. Please give us feedback, insight on this. Again, as researchers, we're going to call for more research. This was a study of basic needs. We recognize, as I mentioned at the beginning, that for some groups, we didn't get as many participants. We also know that this was a very basic needs assessment. So we encourage leaders and officials to dig deeper into these issues. Support our awesome advocacy organizations and our LGBTQ organizations in the region. And then we highlighted 5 areas of need. Really, if you can find one that you're passionate about, 1 or 2, and act, that's how change happens. I know, having been in the world of data for a long time, data is a catalyst, but data doesn't create change, people create change. And so we hope this is a starting point for that type of change, but it takes individuals and not just data by itself. And I think that is the end.
Dr. Chang, thank you so much. If you're happy, we can open it up to questions. I don't need to monitor the chat box. If people have a question, if you'd like to raise your hand, hold on a moment. You've got chat box coming in. Question in the chat, Dr. I don't know if you can read them. I'm happy to read it out for you.
That'd be great.
Was there any consideration given to perceptions of being able to safely and successfully raise a family in Kansas City as LGBTQ plus individuals or family units?
I am going to invite Leah to participate in this. So Leah Youngren was on the ground with me collecting the data, and I think a key partner was the Modern Family Alliance, who helped us think and conceptualize some of these questions. So I'm going to hand off to Leah around that question.
Absolutely. So we didn't include anything within that vein within the survey, but I saw that come out, especially through the focus groups.
Okay.
That was at the top of people's minds. So, raising a family or thinking about starting a family, not feeling connected to other queer families, not having the support or resources needed to raise queer kids. So yes, that was certainly a topic of conversation that we had within our focus groups and conveyed in the report.
Oh, great. So there's information in that report as well, Leah. Thank you. And I did put the link in the report at the top of the chat. Any other questions for either Leah or Dr. Chang, or general comments, observations? Hi, Kate.
Hi.
How are you?
Great. Thanks
Good.
so much, Dr. Chang, Leah. It's so good to see you guys. And I just want to say huge shout out to our chamber staff, Tracy, Joy, and Kat, for also being super supportive and collaborative. I feel like the chamber showed up for you in collecting this data, and I'm really proud of that. And so to me, it speaks to the hope and possibility of ongoing collaboration in our community. So thanks for all your work, and let's keep going together.
Thank you, Kate. I appreciate that. It was a lot to do with our board of directors, Kate and Brandy and others. Were really an incentive for us to get that message out. And we passed out information at Pride Fest as well. So I'm pleased with the results. I'm so thrilled that you got over 11, 1300, whatever it was, I just compared to the other big cities when they got 16, 1700. And I think that was an incredible result. Any other?
Yes, my apologies. The chamber was everywhere with us, from our advisory committee to out on the streets. So it takes a village, certainly, but you were an important part of that village.
Well, we're pleased to be invited as partners, and we'll continue so. So the recording of this we'll create a web page. This will go on there. We'll create a link to the survey. We'll continue to put it out. We'll put a general email out to our members as to where they can get it, but we'll also do an individual email out to all of our members to remind them that they can go and watch the video and they can go and read the report. I was certainly inspired by many things that you came about from what our chamber can be involved in. Not everything, we can't do everything, but there are some key elements there that I thought, gosh, we could do better at, and we could take inspiration from your findings. So thank you all so much. Dr. Chang, Leah, thank you for your time. That was incredibly insightful, and I'm very grateful that you gave us the opportunity to listen to you and learn from this important report. So thank you. Like I say, everybody, thank you for joining us today. We really appreciate it. We'll put everything on our website, and you'll see out on our chamber emails that will give you an update as to where you can find it if you wanted to watch it again, and or again, Dr. Chang's reflect and say what she says. Please share it. Please use the website and share it with other people outside the chamber. Thank you all so much, and have the rest of a great Wednesday.
Thank you, Tracy.
Thank you.